Good morning. Can you hear me?
Yes, Miss.
All
Good morning, Miss.
right. Good morning. Good morning. Good morning. Thank you for being here with us today. Uh, today, we want to come together to speak about a very important aspect of the life of the nurse. If for those of you who worked in various different environments or had through clinicals experienced different environments, you can see that no clinical environment is ever the same. All right. And there are some instances where there seems to be some nurses in control where nothing seems to phase them. They get through their day kind of seamlessly, while there are others who are, just reacting to everyday or moment by moment situations. And we know that nursing is a very challenging profession. And we discuss this over and over again. The thing about healthcare and nursing in particular is the fact that we cannot walk in on any one day and control what happens. All right. For persons that work in the emergency room, they do not know how many patients they're going to come in contact with that day. They do not know uh, how many family members, how many staff members, etc. The day just kind of unfolds on its own. Then you have those for the ICU. You may start off with two patients and you end up discharging one, getting a new patient. So the dynamics of your day shift. You may have a patient on the med surge floor, for example, and they seem to be stable, and then something happens, which we call a change in patient condition. And all of these things, all of these nuances, irregularities, unexpected, and even sometimes undesirable situations occur during our day. Now, there's a particular skill that I want to introduce to you today that helps us. It doesn't matter what the circumstances are, it doesn't matter how the day shifts, all right, will help us to stay in control of our day instead of losing control of the day and then having the day taking control of us. All right, so hopefully we will be here for maybe about 45 minutes or so. Um, we are going to be speaking about the golden hour. So as we go along in the teaching, if you have any questions, you can go ahead and type your questions regarding the concept of the golden hour. And then we will pause and we will take some questions. And then we would love to hear any experiences that any of you may have regarding the golden hour. But what we want is at the end of this instruction for you to leave with number one, an awareness of what the golden hour is, how the golden hour applies, and how we can use it every day, right, to make our day successful, regardless of the environment or what is happening during the day. All right. Okay. So the golden hour, that's our topic, the golden hour. And this is a concept that was actually made popular. I'm not sure exactly who coined it, but it was made popular in the late 1980s by an army surgeon. Okay, he was trying to let persons know that uh, there is a period of time within which, if you can get this time right, okay, it will increase your efficiency, you'll have better patient outcomes and a better healthcare environment. The focus considered being a military surgeon. His concern was about saving lives. Now, the concept of the golden hour, we hear about this all the time. The golden hour, the first hour after sunrise, or the golden hour, the first hour after sunset. It really describes the way the sky looks. Okay, so this concept was adopted by Dr. Adam Crowley. He popularized it. And so the concept of the golden hour in healthcare was first introduced in the trauma department. And yes, you know my history as a trauma trained nurse. So this is where I actually first identified the concept of the golden hour with all the traumas coming from here and there. All right. And they teach, you have all these processes that you go through as an interdisciplinary team to ensure that proper assessment is done, that the issues for the patients are identified quickly, and that intervention is delivered to this patient quickly and seamlessly, with the goal is to preserve that person's life. And since then, the golden hour is applied to just about any area in nursing. All right, it can be applied to admissions, it can be applied to your day-to-day work on the unit. It can apply to any events internally or externally that may occur. All right. So this golden hour, if it is properly understood and effectively used, it will help you with, number one, time management, number two, stress management, number three, patient prioritization, right? However, for the golden hour to be effective, there are certain things that has to be in place. Okay, so the golden hour is a concept that has to be taught. And after it is taught, then persons need to look to see how it applies to their area of nursing. All right. And one of the things that we need to know is, number one, the area of nursing, and number two, our roles and responsibilities, because those will be drivers as to how the concept of the golden hour is applied. Now, one of the challenges that I'm seeing a lot, especially now in healthcare, at this time in healthcare, is a lot of persons are shifting their roles. Okay, persons were fantastic nurse on the floor, right? They control their patients, they were able to take care of their patients, no problem. But now they've shifted into some leadership or management role where they get promoted to supervisor or assistant director of nurses, or even the nursing director. All right. And so now there has to be a shift also with there is a shift with the roles and responsibility. Now there has to be a shift in terms of the areas of the golden hour that is going to be applicable to my new role, and then to apply it, and actually being able to harness the golden hour and apply it to this role, and even to the shift in your role, actually helps the transition to be easier. As we talk about nursing and leadership, there is usually a shift in role, but there is no or not enough guide as to the shift for the mindset, the shift into accepting the new role, and kind of a reintroduction of self to the persons who may have known you as just a nurse on the floor and now having to engage with you as a supervisor. So one of the ways of making this shift successful and reinforcing the shift in role is also to recognize that your priorities change, And if you adopt this golden hour concept and make it a part of that change, it will help to solidify, number one, my focus. Number two, getting the layout of the day just right so that it doesn't matter what happens. My eyes are kept on the roles and responsibilities, and I can support my staff appropriately. All right. So what I'm going to do today, this introduction seems very long, doesn't it? But this is how important the golden hour or the concept of the golden hour is. So we're going to look at some of the applications in more detail of the golden hour in terms of trauma care, the golden hour, how it can be applied to your daily work from taking report, that golden hour after taking report, how the golden hour concept can be applied to patient admissions, how it can be applied from the position of a nursing manager, supervisor, and also from the healthcare leadership perspectives. And then we're going to look at some of the benefits of utilizing the golden hour. All right. So once again, we want to not just talk about it, but we want you to be able to identify the concepts that are useful to you. All right. And as a healthcare practitioner, see how you can apply it to your everyday life now, right? To make a difference in the way you practice. All right. So just to review the introduction, the part that I want you to remember in terms of the concept of the golden hour is that it's that first hour, first hour after arriving at work, first hour if there's a change of condition, the first hour if there's an internal or external disaster, the first hour for admissions. So the first hour of anything, okay, is what I want you to begin to consider. Now, I want you from your role or the role that you're going to assume in a couple of weeks, a couple of months, right? We want you to think about what that role and responsibility is. And as we go through, we want you to grab the concept or the strategy that may be useful to you. All right. And then it would be nice to hear at the end how you can or how you've decided to use this concept. So the golden hour is that critical hour at the beginning of an event. All right, whether it's taking over a shift, a change in patient's condition, a disaster, etc., and how that is used. So the goal is to perform quick assessments to identify interventions that are critical to stabilizing the patient, okay, to prevent complications or deterioration of a patient or a condition or a situation. Okay, so the golden hour can be applied. Okay, now as I said before, the concept of the golden hour was first introduced in the trauma environment by Dr. Crowley. All right, and so for in the trauma period, it is the first hour after arrival in the clinical setting. Okay. Now, this reminds me of actually a conversation we had yesterday in the clinical area where the director of nurses was sharing with us one of their quality improvement projects that they did, how they shifted the process for an event from 22 hours into 4 hours. All right, 22 hours into 4 hours. And this was as a result of assessments. Okay, so now based on that, they developed the things that are important to get done in that first hour to ensure that the patient's treatment process, instead of taking 22 hours, now takes 24 hours. Okay. So the first thing in trauma is a comprehensive assessment. All right. The the assessment is going to identify number one, the critical areas, and then prioritize the life-threatening problems. Now, in healthcare, we use what's the acronym that we use in an emergency? We typically use CAB, right? Anything related to cardiac, like dysrhythmias or bleeding, airway, as in obstruction or strength of respiratory effort, and B, as in breathing, air exchange, oxygenation. That. All right. In the golden hour, the first thing we want to do is to identify any life-threatening problems, okay, and manage those effectively. Now, we don't have to wonder what to do because we've been taught the emergency management as it relates to basic life support and also advanced cardiac life support. So those in this case would be what is it would be what would be engaged. So the first thing is to identify any life-threatening problems, right? And then we move to stabilizing the patient, making sure that the patient's condition does not deteriorate, making sure that all the interventions are going towards preserving the patient's life. There is no decline in patient condition, so it's stabilized. Okay, we're not concerned about getting the patient better at this point. We're concerned about making sure that nothing else goes wrong. All right, so stabilization and then communication. Okay, effective communication across the spectrum. In the event of a trauma, as we know, communication begins from in the field. The communication begins with that first phone call to say, there's an issue here and we need assistance. Okay. And then, so communication now, once that call comes in, there's certain information that is actually given to the person on the phone. And that will help the dispatcher to identify, do we need to send just a regular ambulance or an ambulance that does basic life support? So they have, their cardiac monitor and the persons that go are able to do CPR, right? Or do we need to send an ACLS where the person can get medications en route? If there's a cardiac arrest, then the patient can be defibrillated. Or even higher level transportation are possible where patients can get active treatment en route. They also have what is called flight surgery, where, depending on the extent of the accident, surgeons are dispatched to the site and literal, what we call the trauma hawks, etc., are equipped to begin to deliver care at the site and en route to the hospital for continuation. Okay. And it's the communication that actually helps to facilitate this. Okay, the questions that are asked, the information that is given. All right, so communication. And you're going to see how this applies when we get into the other areas as well. So communication is very important across the spectrum of healthcare. And so proper communication in that first hour. Imagine if somebody made the phone call, didn't give enough information, and they dispatched an ACLS. And when the person got there, they realized, okay, we need more tools, more equipment, etc. So there's a waste of time between getting this new information and getting the resources to that point. While if the correct information was communicated initially, then the right resources would have been deployed, and then appropriate care would be administered at the site. All right, so communication. All right, so communication also allows everyone who is a part of that team to be aware of what is going on and so they can ensure that they themselves are ready. I'm not going to get into the class where we deal with disaster response or anything like that, but as a part of the golden hour, please keep in mind that proper, thorough, complete communication to each member of the response team is very important. Then documentation. Thorough documentation is essential for the golden hour. All right, all the initial assessments, because you want to get what is called the baseline. Where did we start? This is the only way that we can assess if we're meeting the goal of stabilization, right? So we can evaluate the progress of the patient. Are the interventions working to stabilize this patient, or is the patient's condition deteriorating? All right, so documentation is important to track the progress of the patient across healthcare environments, across healthcare hours, minutes, etc. Okay, now as you can imagine, in a traumatic situation, um, trauma is usually unexpected and it is surely undesirable. All right. And so it can be a very emotional situation. It's usually traumatic, not just for the patients involved, okay, but it can also be traumatic for the witnesses. It can be traumatic for the caregivers. There has been instances where after taking care of certain traumatic conditions, doctors, nurses, even housekeepers have to go into therapy because of the extent of the trauma that they see. So the emotional impact can be important, and so even in that golden hour, it is very important that the members of that team and the leader of the team is aware of the importance of managing stress even in this first hour. So we need to recognize that it can be stressful for the caregiver, stressful just as much as it is for the patients, the families, and the witnesses. So it is going to be important for the nurse leader or the manager to have a calm demeanor, to ensure that everything that is needed is there, that emotional support is given during this time. Usually, when persons become emotional, they get to a state of frankness, and then persons begin to get loud and erratic. Not a time for this, okay? In a traumatic event, you want to remain calm. You want to keep focused on your training and getting the tasks done. If something may fall, that's all right. You just pick it up and you move on. This is not the time to have discussion about who's doing what. All of this should have been done already. All right, and we're going to speak a little bit more about this later on as we speak to the educational part of the golden hour. All right, and so a part of managing even in this golden hour is also to keep the families up to date on what is going on. So the nurse got be taking care of the patient in this golden hour and communicating with the families at the same time. So that is why you have a team that works together in trauma, because now there's a team member that's allocated to providing this emotional support to the family members as well, to help to get them through this traumatic golden hour. So for trauma, really, it's about number one, making sure that the assessment is complete and the prioritization of care is identified, that communication is effective and thorough, and to all the persons that may be involved, that the documentation is precise and ongoing, and that emotional support is delivered to the patient, their family members, and also the staff involved. Okay. Now, when it comes to the everyday nursing actions, one of the first things we do when we enter a unit right, is we take report. All right. So in the first hour, you don't want to waste your first hour. Some of the things you do is number one, you take reports, you review the patient's medical chart, you want to know their history, what's the reason for them being here. You identify what is called the thrust of care. So usually we encourage the top, identifying three critical areas on which to focus on first. That's a part of prioritization. In the first hour, you want to ensure that you establish a rapport with your patients. So you take report, you review the chart, you introduce yourself to the patient. This should be the introduction should be taking place during your walking rounds with the other nurse. So the outgoing nurse will notify the patient that they're leaving, you're coming on. So you introduce yourself, establish a rapport with the patient. And based on the chart review that you've already completed, you would have some information about the patient. So you may want to ask the patient questions at this point. So number one, it's a part of establishing rapport. But number two, it informs the patient that I'm aware of your condition and I'm here to take very good care of you. However, I also want to know what's important to you in your care. So once you've established that, allow them to express any concerns, ask any questions. This will help to create trust between you, and the patient will see in this first hour that, okay, I can relax today. I have a really good nurse who's knowledgeable and is concerned about me. All right. You want to ensure that even though during walk-in reports, you may do quick assessment, and the quick assessments would be make sure the patient is breathing, that their pulse is adequate, that their blood pressure is good, that their skin is warm and dry, and that the patient is not in pain, and that they're repositioned. Okay. And then after the report, still within that golden hour, you want to get your thorough physical assessment complete. All right. And you want to pay attention to any specific areas of concern for the patient's health and also for the patient personally, because sometimes the area of priority as it relates to healthcare is not what is a priority for the patient. So we also want to establish that during the first hour to let the patient be aware that you are also concerned about what's important to them, even if it is not related to healthcare. All right. Then after you've completed your full assessment, you want to review, validate, and update your care plan. So you're going to view the care plan. You're going to validate what is still relevant based on your assessment, because patients progress. Their condition may change, it may improve, it may decline. So the thrust of care may be different. So you want to validate what remains and then revise what may have changed. Okay. So the plan of care guides the care of the patient. So we want to make sure that that is updated. All right. There are other members involved in the care of the patient. All right. We have interdisciplinary teams. We have the lab that may have done blood tests for the patient, radiology that may have done CT scans, X-rays, MRIs, etc. All right. There are physical therapy, occupational therapy that is a part of intervening in the care of the patient. We can't rule out or forget about dietary, which is a very important part of health. So we want to ensure that we are collaborating with the interdisciplinary team during that golden hour, also getting our lab results, our radiology results, any updates with diet, patient's nutrition, etc. And then to coordinate care, scheduling of the patient's therapy session, ensuring that there are no duplications or there are no conflict in terms of scheduling rehab and x-rays at the same time. Okay, so all of these need to be done to make sure that any uncertainties are clarified, any collaborative communication is complete and thorough, understood and agreed upon by all the members involved, which would be the interdisciplinary team member that you're communicating with, and also with the patients and the routine patient care. So we need to be aware of that. In the golden hour, ladies and gentlemen, communicating with the patient's family or support system. And this one is very important. One of the things that we typically see is that patients may have relatives that are very zealous and they're very forward, and usually it appears as if they have a lot of complaints. And so when we see these relatives coming, we tend to go away or not go in the patient's room when they're visiting. And this is actually an error. What we want to do, okay, is to make sure that in the golden hour, we're communicating with these family members, especially the ones that may be tagged difficult. All right, when we see them coming, we want to approach them. Hello, how are you? I'm so and so. I'm taking care of your loved one today. If you have any questions or comments, let me know. All right. Sometimes they'll be taken aback because they are the ones used to chasing and complaining. Now you're coming forward. All right. Complaints will change to compliment if you engage this approach. If you know the relative typical calls to find out how the patient is doing, you call them instead. Hi, this is so and so calling from XYZ. We would like to give you an update on your loved one, and you give them an update and let them know what to expect. All right, so communication allows them to be involved. I want to qualify that these family members that you're communicating with would be authorized family members. Okay, we don't want to leave that out. Authorized family members. All right, and that we are keeping them up to date on the patient's progress. That gives them some peace. All right, and then after doing this, you can set your goals and priorities for the rest of the day. Your goals and your priorities. Who is going for what and when? What medications needs to be given, or any other intervention? Who's going for surgery? Things like that. So you set your goals and your priorities. And then you have other team members that you're working with, like the CNAs. You want to get them involved in the priorities. You want to let them know what your priorities are and what they need to report to you immediately, things like that. There may be the tendency to just go from room to room, maybe do vital signs, AccuChecks, etc., and just document it. All right, we need to reinforce to the CNAs, hey, this patient gets this. Please notify me immediately if certain conditions exist. So we want to also ensure that while we're establishing our goals and our priorities for the day, that we're engaging all those team members that assist in the care of the patient, all right, which includes our nursing assistants. And of course, once again, documentation. You want to ensure that as you do, you document. So you don't go from room to room to room and then sit and document. No, you're in a room, you engage with the patient, you document that engagement. You move to your next patient of priority, then you engage and you document. All right. So the golden hour for the nurse on the floor is really a time to assess our patients, all right, to gather all the information, engage with the interdisciplinary team, communicate anything that is relevant at the time, establish our priorities, and document. And if you can get this done in this first hour, you are guaranteed a successful shift. Even if there's a change in the patient's condition, all right, you engage the golden hour for the change in patient condition, and that too will get you right back on track. All right, all of a sudden, you're going to have a little secret in healthcare that it seems to be elusive these days, but a little secret called downtime. All right, and downtime is not really to just sit around and do nothing. Downtime is to engage your patient some more, to review your plan of care, to review your priorities established for the day. All right, see where you are, and then to see what next it is that you are going to do. And it also affords time if there's an event, right, for you to be effective within that event without interrupting your patient's goals and priorities of care. All right. Uh, I'm going to take a question. There's a question in the chat. Let me see. Um, this question is from Mrs. Dixon. Is it okay to call the relative to give updates since it is said we are not to give information out on the phone? Or did you mean if the relative is at the institution? This is an excellent question and a very good time for clarification. Now, there are established protocols for telephone communication. The rule is not do not give information on the phone. The rule is that you need to know who you're giving information to on the phone. Uh, this is a global society in which we live now, and the next of kin for a relative could be overseas, could be in another city, could be at work and not able to come now. So facilities have protocols where when they come in, they identify by the patient or whomever it is that is taking the patient in, who the persons or the responsible persons are. Okay, and that would be documented. Some facilities actually give a code to say if you call and you have this particular code, then that is clearance for you to receive information. But then the person who receives the code, you have to let them know this code is only to be given to persons who are authorized to receive information. So as long as you follow the protocol of the facility, the established policy, all right, and you do due diligence going through the steps to verify that this is the person that you are authorized to speak with, then yes, you're able to give information. All right. So it's not about not giving information on the phone. It's about following the facility protocols to ensure that patient privacy is maintained even during telephone communication. And you mentioned something about someone being at the facility. Even with that, we have to be careful because persons come to visit, but it doesn't mean that they are an authorized person to receive information. So them being present at the facility does not mean authorization to receive information. So you have to be careful that even if the person is present, even if the person is in the patient's room, even if the person is asking questions in front of the patient, you want to first verify who is this person? Is this person authorized to receive information? And you say, I'm not authorized to give you information. However, the patient is free to answer any questions that they may have or any information that the patient wants to share. So even if they are present, we also have to be careful about divulging information. Okay, go ahead, Ms. Agiochi. Go ahead with your question, please.
So my question is this, Mrs. Carnegie. I've had a patient in hospital. The family doctor called to say, "Hey, I am so and so, Doctor so and so, and I need an update on my patient." So I said, "I'm sorry, are you a doctor that works in this facility?" And she said, "No." I said, "Are you the patient POA?" She said, "No." So I said, "I'm sorry, I can't give you any information. You would need to contact the POA for updates, or you can contact the hospital doctors if they want to pass the message to you, but it's beyond my control to pass that message." And then she asked, "Oh, can she talk on the phone?" I said, "She's your patient. You should know her." Oh, does she has a phone? I said, "If she has a phone, you can call her."
Right. So the patient can give information, and that happens actually a lot. And, this is a little bit of a segue, but it really points to communication and what I call compliant communication, which is another teaching, all right, compliant communication. However, um, persons will call, because I've shared that experience as well. A person call and say, "This is Dr. So and so. How is?" And they give the name of the patient. Now, I wasn't familiar with the name of the doctor, so I said, "Can you hold just a moment, please?" I went to grab the patient's chart, and I said, "Can you repeat your name?" Okay, repeated his name, and I looked through the consultations. I didn't see his name. I said, "Are you consulted on this patient?" And he says, "No." And I said, "Well, I cannot give you any information. I'm so sorry. You can contact the patient directly or their primary caregiver." All right. But, it could be in the instance that I'm telling you about, the doctor did make a little confession. He is a doctor for real, but he is the husband of a friend. Okay, so the friend wanted information on her friend and asked her husband, "You're a doctor, call and get the information and give it to me." So we really have to be careful with this telephone communication issue. All right, we're going to take Miss Johns and then we're going to move on. I want to touch on a couple other topics in the golden hour before we close this session. Go ahead, Miss John.
Yes, even in the matter of a person that is a no pub, when they call, even if it's a family member, we use the code for the no pubs. And then we verify who has it. It should be, usually they have about 2 or 3 people that have it and no one else in the family does. So if they show up, we can't even tell them that the patient is in the building without that code.
All right. So thank you. You're touching on another thing, which is used. It's used in the event of certain traumas, in the event of a celebrity, in the event of a protected population. Okay, children, pregnant women, prisoners, etc., where you cannot even disclose if a particular patient is in the hospital or not. So there are some instances where it doesn't matter if you have a code, all right, then you're not getting information on the phone. Okay, based on the information that is collected, the facility will contact you, but it doesn't matter where you are. You're going to take a flight and you're going to come and we'll speak face to face. So there are certain conditions where patients may go under aliases, etc., to enhance privacy and compliant communication. All right. So thank you for that discussion. Now we're going to talk about admission. Now, it is my fervent belief that if we can capture an effective admission, the entire patient's stay will be seamless, productive. But I'm going to try to keep it just to this golden hour that we're talking about. So the golden hour for patient admission, okay, first of all, is when it comes to patient admission, the patient has to be prepared for. Some of the areas of preparedness is number one, the facility has to decide, are we able to take care of this patient in terms of staff, in terms of resources? Number two, say we have staff and resources, are the resources in place? Okay, is the room ready? Are the tools and equipment required to take care of this patient safely? Are they present, available? And in many instances, they need to be present in the room even before the patient arrives. This is in preparation. The team has to be notified of the admission or the pending admission. And then upon arrival, the team is notified that the patient is in the building. So each member of the team can begin to execute their role in the patient admission. All right. So the golden hour for patient admission, once again, is to do a rapid assessment and take care of any current issues. Okay. Many times when we get admissions, the admission comes through the emergency room. So the patient will be relatively stable at this time. All right. However, once they get on the units, we are doing our own assessment, making our own priorities. All right. Making sure that the patient's condition is indeed stable. Because believe it or not, patient's condition can change from moment to moment. It can also change during transport from the ER to whatever unit it is. So another assessment is very necessary to once again validate the report that was received and to include any additional information that is received upon admission to the patient. All right. So you're doing your rapid assessment and stabilization. All right. And you want to ensure that the goals of care are established. All right. And we begin to teach the patient upon admission, teach them about the unit they're on. We orient them to the room. We orient them to the room, the tools and equipment in the room, how they're used, okay, and what is expected during the admission and after the admission. All right, so we want to ensure that we're beginning our education with the patient. We don't just walk in and introduce ourselves and start care. We need to ensure that everything that we're doing, the patient is informed ahead of time. And of course, even in some instances, we'll still have to get their permission. Okay, their priorities may be different from ours as well. If they're in pain, they're not going to be concerned about eating food, even though there may be a reason why eating food right now may be important. Okay, so we want to ensure that we are getting those involved. Now, one of the things that we must orient our patients to is our call light, and we need to let them know how to use the call light and when to use the call light. The call light is there so that the patient knows that they have access to the nurse. Okay, they're not here alone. A new admission, especially if they're new to the healthcare environment, it can be very daunting. All right, and so orienting them to the healthcare facility and then them being left in a room all by themselves. Okay, the call light, the call bell becomes a connection to the healthcare team. So they're assured that they have access to the nurse. So the call light should always be in reach of the patient. One of the last things you do before you leave the room is to give them access to that call light. If you see a call light on, never pass. If it's your patient or not, you want to pause, check in to see what it is that the patient needs. Could be something simple, but then it could be a life-saving opportunity for us. All right. And so the golden hour, even for admission, as you can see, begins before the admission even arrives on the unit. All right. Now, the nursing supervisor, in assuming her role as a nursing supervisor, all right, has some things that she can do, he or she can do to ensure that the golden hour is successful for her as well. So in the golden hour, all right, we want to make sure that the tasks are prioritized. So the supervisor should have or develop a routine of priorities that are completed during the first hour, like making sure that patient rounds is done. Okay, you get your reports, yeah, whatever reports. One of the most important reports is your patient census. How many patients are in the building and where are they located? And you round to make sure that every patient that is on your report is accounted for in the building, or if they're not in the building, their transfer is or their movements are appropriately recorded and documented. All right. So so the nursing supervisor, the unit manager, they need to develop an area of organization. Examples, as I said before, you come in, you get your report, you do your rounds, making sure all the patients are accounted for. You want to know the procedures for the day. You want to know your staffing to make sure that your staffing is appropriate and you have the right skill mix to effectively care for your patient. All right. If there are any immediate concerns, that you're using the proper protocols and procedures in addressing whatever that is. All right. Ensuring also that the staff assignments are appropriate and each person has assumed their role. It is not unusual to come in and see that a nurse may be running late, right? Or there was an incident on the road and the nurse may not even be able to turn up, right? Things like these can occur. What do? You should have your plan in place, okay? And engage your staffing coordinator. Maybe a supervisor or a manager may need to jump in, take some patients while the staffing coordinator tries to get another nurse in to take over that patient. So once again, in the first hour, these are some of the things that needs to be done. All right, their best practice as it relates to communication is to have a little huddle at the beginning of the shift to make sure that everybody's on the same page and the new information is communicated to the team. All right, and that if there are any concerns regarding patients or even the staff members or the healthcare environment, okay, that those are brought up and addressed, or at least action that begins to address whatever areas of concerns that arise. Any questions? All right, so along with communication and staff assignments, you want staff support. One of the greatest time wasting events in healthcare is searching for tools and equipment and resources to use. So the role of the unit manager, the staff, the supervisor, etc., is to assess to see what tools and equipment are needed, if the supplies are going down, and to get those replenished. Ensure that things are kept in their proper places, so nurses are not wasting their time searching for resources that should be present and available to take care of patients. And so there may be a need to, and of course, there are different facilities that have different strategies as to how to manage this kind of thing, or to support staff materially as it relates to having all the tools, equipment, and supplies that they need to take care of the patient. All right. In the golden hour, we're looking at quality assurance measures. Quality assurance is a part of everyday operations. All right. So we want to make sure that our protocols are being adhered to, right? That our policies are in place, patients' rights are being maintained. All right. All of those are parts of quality assurance. And if we can identify and or validate that these things are in proper place, then it is fine. If anything is identified, then to begin corrective actions right away. All right. Another part is to make sure that your emergency system is in place and operational. And one of the first things that we do is to check the crash cart. Okay, check the crash cart to make sure that number one, it's properly your defibrillator is properly charged, that all the supplies and equipment that you need are there, that your oxygen tank is full. I cannot tell you how many times we walk into different organizations and we take a look at the crash cart and that tank has been used or there's a leak. Okay, so the crash cart should be checked at least every shift. At least when I go in, I'm checking to ensure that all my crash carts are in proper working order. All the oxygen tanks are full. Everything that we need on the crash cart is there, including medications, including Band-Aids, right? Okay, anything, it doesn't matter what it is, that is expected to be on the crash cart should be there. And another area of importance, making sure that it has not expired. So when we're doing our crash carts, we can't just look at things and say, oh, it's there, it's there. Is it expired? Is it still usable? All right. So we want to make sure that all of that is in place. So your emergency preparedness is in place. Your emergency activation system is also in place. All right. And so for the supervisor, their role is basically number one, to validate information and to provide support to the staff, right, to ensure a successful shift. Now, I have a lot more information on the golden hour and how it can be used. All right. We have it for the nurse, for the healthcare leader as well. All right. So before we leave, okay, I just want to get this little bit of information in, because when it comes to the golden hour in healthcare leadership, the golden hour is successful based on preparedness. Okay, preparedness, not just of the nurse, not just of the unit, but of the entire facility. All right, and every member of the team becomes a stakeholder in the preparedness of the facility. So when the CEO comes in or the director of nurses comes in, they do have their areas of the golden hour that they should endeavor to accomplish, okay, before the day gets going, and that will also help in managing their day. All right, and so for leadership, a lot of the golden hour is steeped in education and preparedness. Education and preparedness. Now, for healthcare facilities, they have to be prepared not just for internal disasters or events, but also for external. And so the response system, the different teams that are going to be involved, all right, the different things that are necessary to be in place, it is the responsibility of each member of that response team to know what their role is, what their responsibilities are, and to be always ready. And it is the responsibility of the healthcare leader on a day by day, month by month, okay, quarter by quarter, and year by year basis, depending on the type of events that they're being prepared for, to test, to examine, and to ensure that these things are in place. So there needs to be education about the response, and each person has to be educated on their expected role and responsibility in the response to an emergency. And they need to revise this from time to time. When I was a nursing supervisor, if I had 3 days off, I'm studying ACLS before I go back to work. For some reason, I just need to be prepared for that. All right. And so we want to educate persons on the triage system, on the different members of the healthcare team and their role, who is responsible for what, and making sure that when an emergency system is activated, whether for internal or external event, that each person is available, right, to respond. What about vacations? What about a day off? It doesn't matter. There ought to be someone in the building at all times, or available to come into the building at all times to engage in any facility related golden hour need. Okay, as a part of the education for the golden hour for an organization also includes community education. Yes, so the community needs to be educated on how and when to engage healthcare and how to potentially save lives in the community. All right, and also how they can engage with healthcare. All right, in various events. Now, in terms of external disasters, there are some that varies from geographic location to geographic location. In Florida, it's typically hurricanes. All right, up north, it may be snowstorms, things like that. So each facility, based on their geographic location, has to be prepared for response response to a disaster, whether it's internal or external. And as it relates to the golden hour for the healthcare facility, it's always about being prepared so that during the first hour of a response, it can be seamless, life can be saved, complications can be reduced, okay, and just for an overall positive outcome. And in all areas, communication and emotional support are areas that need to be prioritized. So it looks like I'm a little bit over time. However, what I would love to do, if you will permit, is to take maybe about 5 minutes to get some feedback from you. When you enter, I would like you to say your name and the location of your place of work, just the geographic location of your place of work, and then share with us what you've learned from this session on the golden hour and how you think you'll be able to use it. So your name, the geographic location of your place of work, and how this instruction is useful to you. Okay, who would like to begin? Okay, so let us incorporate what I like to call a pass the mic moment. Okay, so I would like to start on my left, Mr. Ricketts. Your name, although I called your name, the geographic location of your facility, and how beneficial this instruction has been to you. Go ahead.
Okay, morning everyone. My name is Maureen Madeira Ricketts, and I am presently working in the Cayman Island. This is all of what Miss Carnegie has said. This is how we approach it back there. They do have the golden hour where we try to tell about what happened on the last shift, what is expected to happen now, and what anything that is different, anything that is expected, we always try to do. We call that the huddle in the mornings.
Mm-hmm.
That's what we do. And if anybody have any growth about what happened yesterday or what is about to happen, then that's the time when we just speak on the floor. In the event of during the day there's an emergency and we need another huddle, then we do that. But what you said, Ms. Carnegie, we are definitely doing that back there.
Right there. Okay, fantastic. It's good to know, and it's working. Yeah.
Yes, it does.
Okay.
It does work.
All right.
Pass the mic. I'll pass it to Jason Rowe.
So your name and the location of your place of work, if this concept is known to you or new to you, and how you'll use it.
Good morning, everyone.
Good morning.
Good morning, everyone. Again, my name is Jason Rowe, Black River Hospital, and yes, I am familiar with as Miss Maureen said, the huddle. So the nurses at the hospital, they do that. Every nurse comes on the shift. They tell the nurse that is coming on what happened, if any interesting happened, how it was resolved. Yes, they hand over to the other nurses. And yes, ma'am, so I would know that.
Okay, so thank you for that. Number one is you don't have to give us the name of the hospital, just the location of the hospital. All right. And number two is I'm glad to see that some aspects of the golden hour is being used. I hope that during the lesson you weren't so focused on what you've seen, but what you could also take and incorporate, because the golden hour is really a guideline, okay, and a huddle alone is not a guideline for your day. All right, there are other concepts that were communicated, and maybe I'll go ahead and publish this because it's being recorded. We'll publish this so you can go back and look over and listen over it, and to capture, because sometimes in one lesson you may not capture all the essences, and so we understand that in education, repeating concepts may be necessary. So you can listen again to say, okay, with the golden hour, I'm aware of huddles. Okay, what else is there that I can utilize to make my shift successful? All right. All right. Okay, Okay. So Miss Rowe, please pass the mic.
Okay, Miss, I pass the mic to Miss Monique Ichiochi.
Okay.
Hi everyone, my name is Monique Ujioche. I'm currently in Toronto, Canada. In the hospital that I work, we do use the golden hour where we inform the receiving nurse of what happened for each patient on the previous shift. We also try to utilize that hour to do a first set of vital signs to see where the patient is at compared to what the nurse has passed to us. And we try to pull our 8 o'clock medications at that within that hour, because it's between 7:30 and 8:30. So we pull our 8 o'clock meds, and usually at 8 o'clock we would have a shift report where all the nurses, including the nurse manager and the infection control personnel, would come, and we do a general report of all the patients, so we all have an idea of what's happening on the unit, not just with our patient, but all the patients that are on the unit, and what's expected throughout the day. Like if we have any discharges coming up, and if we have any expected admissions or transfers. Yeah, basically that's what we do.
Okay. That's interesting. All right. Thank you so very much. All right. Go ahead and pass the mic.
Oh, I passed the mic. Who's next to me? So just on Kimon. To Kimon Aliman.
Good morning, everybody. All right, so yes, I am from Jamaica, Black River to be exact. We do have this golden hour where we majority of the times whoever work prior, like the day before, may not be the person who come on the other day, so they might not know everybody. Should in case we have an admission, this is where we take the first hour to brief the staff on who is there. We go from bed to bed, talk about the patient, what is important, what was done, what is to be done. Whoever receiving the patient can do their brief assessment. Whatever plan was made is discussed in this hour. Yeah, we tend to do the first vitals here also. And should in case the patient have any query, we can still have dialogue because we're from bed to bed. So if there's any concern, we try to, write it down, make a note so we can always come back to the patient and see if we can, how best we can help them. So yes, we do have this.
Okay, so the concept of the golden hour is used not just the activities, but the concept. Okay, go ahead. I would like you to pass the mic.
Okay, so give me a second. Okay, so I would like to pass the mic on to Miss Pamela.
Good morning, everyone. My name is Pamela Powell. Manchester, Jamaica. So, I can't recall hearing the term the golden hour because I've been in the clinic settings, but we've done like pre-conferences and stuff like that. But based on what Miss Carnegie taught this morning, I have realized that within that golden hour is crucial because if within that golden hour the goals that are set are met, or the things that are supposed to be in preparation are in place to for the clients to come in and to expect the unexpected. If those things aren't in place, then after that hour, then everything else follow will also be behind, just because the golden hour was messed up. So I realized that the golden hour is very crucial, vital in order to have a smooth sailing day going onward.
Fantastic. Thank you so very much for that. I'm going to ask you to go ahead and pass the mic.
So Miss Johns.
Good morning, everyone. My name is Nikisha Johns, and I am located in Central Florida. So, the golden hour for us, we have a morning huddle where we go over the entire overview of the floor, what's going on, who's been intubated, extubated, who's going for surgery, who came back from surgery, if we have any education, skill assessments, and transfers in or out. And then the nurses disperse to their areas where they get reports from the overnight shift, and each nurse with their partner go into the room and assess their patient, do a two-person skin assessment, and then they finish their reports, and after which the nurse would start with his or her head-to-toe assessment and do their medications and their vitals and AccuChecks, and then they go from there.
All right. Thank you so very much. Maybe, okay, go ahead, pass the mic.
I pass the mic to Miss McLeish.
Okay.
Hi, good morning, everyone.
Good morning.
Yes, we do have that hour. Well, my name is Ingrid McLeish, and we're from Mandeville Regional Hospital. We normally have a general handing over for each shift. So the nurses coming on will go from bed to bed, and we report report the patient name, what was done for the patient, the plans that were carried out, and sometimes we might not get to complete every task that was in the plan for the patient. So you hand it over to the incoming nurse, and they will continue the plan. So we move from bed to bed, and we give a report on the patient. And then the other shift will take up from there, do their assessment, and continue.
All right.
Basically it.
All right. Thank you so much for that. You can go ahead and pass the mic.
I pass the mic to Miss Pickard.
Oh.
Good afternoon. Good morning. My name is Tashina Picard. I do not have experience with the golden hour, but I have been taking notes.
Okay.
So from my understanding, the golden hour is a good implementation for any hospital. It is needed so that the rest of the shift would be held in order. And I would make sure that any hospital that I go to after my training and I pass my exam,
I'm going
if
to
the
ask
golden hour is implemented, I would
Ms.
figure
Pickard.
out a way to help it into my shift.
Ms. Pickard.
Yes, miss?
I'm going to ask you to slow down just a little bit because we're not able to make out some of your words because you're speaking so fast.
Okay, I was saying that I learned a lot about the golden hour, and I learned that the strategy is very important for the rest of the ongoing shift. It is very vital for patient care and patient understanding. And the last bit was that if it isn't at the hospital that I plan to work for in the future, I would ensure that I implement it into my daily shift work.
Oh, fantastic. Thank you so much. It's very nice to hear that. All right, so I'm going to ask you to go ahead and pass the mic.
I pass the mic to Josan Rowe.
I think she went already.
Did Miss Monique went?
Yes. Okay, so maybe Miss Bourne or Mrs. Dixon.
And Miss Colleen Bourne.
Good morning. My name is Colleen Bourne. The golden hour is not strange to me. At my former place of employment, we do have the golden hour where it is discussed on a daily, sometimes 3 times, because we have our first handing over at 7:30 a.m. And by midday, the nurse manager will be on taking her report, walking around at each bedside. Majority of the wards are like 25 beds. So she have her midday report, and by 2:30, we have the general again, where we hand over to the oncoming shift. Sometimes on the 2:30 shift, they do have teaching sessions where first patient care assistants were not really looked upon, they were always being looked down on. So when I was leaving it, they were being sensitized that patient care assistant is a very integral part of the nursing staff. So patient care assistant will also be doing teaching sessions. And because majority of the time, the patients would more confide in the patient care assistants more than the nurses, because sometimes nurses have 6 patients, right? So the nurse wouldn't be able to spend that quality time with each patient, right? Majority of the time, something is always happening. Sometimes during the handing over, we have persons that crash. Sometimes nurses have not completed their task because of a hectic day, where you would have patient be going to and from X-ray, ultrasound, MRI, to and from surgery, doing all those things. So the golden hour is not strange. It's not strange. I pass this button on to Miss Dixon. Please.
Ms. McLeish, are you trying to add something to your comment?
Sorry, miss.
All right, thank you. All right, so you pass the mic to Mrs. Dixon?
Yes, miss.
All right, Mrs. Dixon,
Good morning, everyone.
good morning.
My name is Aldit Graham Dixon. My work location is in the Bronx, New York. I actually work at 2 different facilities. So one is actually a day hospital, what we call back home the clinic. But in this facility, there are minor surgeries and like cancer cell removal. There's an operating unit also, which sometimes we're asked to assist on. One other thing on that unit, no one can pick up a client or patient without their name was the name that was given at the initial before the surgery, whether or not the person is conscious, as fully recovered or not. No one else can go to the unit to receive that person. It has to be the person that's name was given. Also, we do have a 5 minutes time in our lunch period, which when whoever's going on break, we tell them what is happening, who is in a room, any abnormality that we discovered in the vital signs, if it needs to be rechecked before the patient leave after, because sometimes we have to recheck it after the doctor finished the consult to see if there's a change in the vitals there. And also on the cancer removal side, we have like the codes, all of those stuff are in place, crash cart, everything is in place there. So whoever comes to that unit, you sensitize them on where to find what and stuff like that. So the other facility that I work is, we actually have a change in shift there where we do a room to room handover, and persons who like left for the hospital, we make the other shift aware that somebody is transferred out to the hospital. Somebody, if there's an internal transfer, that person is either up top floor or bottom floor. If there's a bed change, we notify them that there's a bed change. This person is no longer at 101, but is now at 104. And because sometimes, even though the change has been made, it's not yet changed in the system. So you might go in the system and you will see John Brown at 101, but when you go to 101, is Mary Jane there, and you'll be wondering why is a female there. So we make note of that so that it can be notified that by the time the change is made in the system, there should be no error in medication or any care that is supposed to be administered to that particular person. There's also the two nurse count narcotic handover, because in that facility, LPNs do have to receive and hand over narcotics, and it should be done by 2 nurses. So we do that, as well as notify each other of where we have the oxygen store, all of those stuff that's needed. If we get in a patient from a hospital, we are notified that a patient is coming in and there's a unit that particular unit is the only unit that takes admission. So if that unit is full, we do a transfer out to another unit from that unit so that we can have the bed space. Or if it's a private room, we can have a private room there. We transfer the patient to another unit. So those are some of the stuff, and we have to give the supervisor also a report before, even though we do a report to the regular nurses, and also the CNAs have to be aware also of the patient's condition, because they have the upfront contact with them, because they're doing the immediate care right there. But what you have said, it's like a reinforcement. And had I not been in another facility, some of the stuff then I would not be aware of, even though I've worked at an hospital before. But it's not, every facility does their thing different, so yeah, it's reinforcement for me right now. Thank you.
All right, thank you so very much. So we had a real mixed group here. Some persons who had experience with it, some persons who've heard of it for the first time, and then others who've identified exactly how they can use the golden hour to their benefit. However, what I would like to say is thank you for giving us that feedback, because that feedback actually helps me to recognize some areas that I need to reinforce as I do my review. I'll pause. Go ahead, Mrs. Dixon.
Miss, one other thing I also understand from this whole golden hour is that it's a critical hour between life and death. Mm-hmm. That's what I look at it as, a critical hour between life and death, because that 1 hour, the preparation that you make in that 1 hour, or you do not make in that 1 hour, the end result will tell you what was done or what was not done.
Right. And so thank you for that. That's a very poignant point to reinforce. The golden hour is not about routine. The golden hour is to identify areas that are critical to your day and making sure that those skills, strategies, processes are already in place. So much of the feedback that we received was just explaining about the reporting and the reporting method and what is done during that first hour. However, I would like to reinforce that the role differs based on the or the priorities differ based on the role of the person. Now, a nurse on the floor, okay, their routine may be to they go in, they pull their patient's report, they review their charts for labs. Okay, so you're looking for tests and procedures that were done, results that are available. What does that result mean? All right, any communication with the interdisciplinary team, right? Taking report, speaking with the patient, etc. It's not just about walking rounds. It's about getting all the information that you need and making sure that the tools and equipment are present. You don't want to be getting ready to do a wound care and you in the patient's room with the wound cart, and then all of a sudden you realize you're out of supplies. Okay, that golden hour is spent to reviewing what you have, what you need, and to ensure that the supplies are there. So that way you go to do this wound care, you don't have to wonder if you have the tools or equipment, they're there. A code is called, you grab a cart, confidently knowing that all the things that you need are on the cart and are working, right? So this is the use of the golden hour. It's not just about taking report. Okay, it's about ensuring that everything that you need to use on the shift are present and available. You know who's going where and at what time, what resources may be needed. So if anything occurs during the day, it would be something that is unexpected. But even though it's unexpected, right, you have your process and you have your tools and equipment to manage it effectively. As Mrs. Graham reinforced, the concept of the golden hour really is to preserve life, to quickly identify what is going wrong with a patient or with your day or with your staff, and to effectively respond, okay, in an effort to minimize, number one, to preserve life, to minimize complications, to minimize stress, and to be effective and efficient in care delivery. Okay, so Ms. Ricketts already said thanks. As I said before, this session is recorded, so I'm going to go ahead and post it, and I'll send out the link for it so you can go over. There's a lot of very pertinent information that you can use, and hopefully the concept will be more understood. Don't feel pigeonholed into the process that you do at your job. One example was someone who is working at two places, and even though they're aware of the concept of the golden hour, it is used differently. The important thing is, now that you know an extended version of the golden hour, you're sensitized as to how this golden hour really is to be used. How can I make what I do more efficient? How can I prepare more in this golden hour for my entire day? All right. And so this is the goal of the golden hour: to preserve life, for early identification, for quick and seamless intervention, to minimize loss of life, to minimize complications, to minimize stress. Okay, if we can't alleviate it completely, it can always be our goal to minimize. All right. So thank you again for your time here. I'm going to go ahead and stop this recording. However, if if you have any comments or any other ideas that you would like to share, when you get the recording, feel free to add your comments to it. We'll continue to learn from each other. Remember that the golden hour is not something that you can you just get up and do. It comes with a series of learning your policies, learning your protocols, learning your tools, learning your equipment, learning prioritization of patients. So the golden hour for someone who is advanced in healthcare, the golden hour is something that they can, adapt and easily apply. For others, it will be a process where we learn and improve day by day. So instead of taking 22 hours to do a process, we can shrink it to 4 hours by incorporating the strategies of the golden hour and applying it to our everyday practice in nursing. All right. Give me just a moment as I